This is Dr. Jim Chappuis from Spine Center Atlanta, and I'm real privileged to be here with a former patient of mine, Mr. Zach Gaeta, who had surgery with us. We were just talking about it about 5 years ago. He had a disc herniation in his lower back, failed conservative care, and then underwent an anterior lumbar interbody fusion. And we're going to ask him a few questions about his pain and activities before and after. I'm going to just introduce you to Zach right now.
Zach Gaeta. I am an attorney. I work with Diaz Gaeta Law. It's my law firm. I'm a partner. And what we do is we do immigration, criminal defense, and personal injury as well. I've been practicing now for about 8 years, actually 10 years now. 10 years now, and we have a practice in Marietta, Georgia.
The operation we performed was an anterior lumbar interbody fusion. It's basically done for patients that have intractable back and leg pain that doesn't respond to conservative care. It's a back fusion, and it's done through the stomach. With a back fusion, you can either do it from the back, the side, the front, or front and back. Over the years, we've found that especially at one level, doing a back fusion through the stomach or an anterior lumbar interbody fusion gives 90-some% success rate with minimal complications. So Zach, I know you had back pain, but what exactly brought you to us? What prompted you to have the surgery? You were in pain, but what was it that finally said, you said, I've had enough, I want surgery, and then what was it like afterwards?
Absolutely. So I actually came to Spine Center based on my own research. I did a lot of research between doctors here in Atlanta. You know, after I had my car accident, I wanted to actually get the treatment that I knew I was going to need. And I ended up with Dr. Chappuis. Dr. Chappuis and I hadn't even met prior to my treatment here. I think that was probably the best decision I ever made. What I was dealing with after my accident was debilitation. I mean, I was essentially not the same person I was prior to the accident. I had a lot of sciatic nerve going down my leg, which essentially would not let me do the things I used to do. I used to be in the gym a lot. I used to do cardio. I had a lot of ways to deal with my stress. As an attorney, I need something to vent, right? And exercise was my way out. And so with the sciatic pain, I was not getting the sleep. I was not getting any sleep. Essentially, I was on occasion, on a good day, I was getting like five hours sleep. Anyway, I turned, either laying down or sitting or walking was even painful, and my pain level was like anywhere from a 7 to a 9. 7 on a good day, 9 was on a bad day. And I eventually just decided, you know, this has got to change. You know, I got to have some type of difference in my life, because I was dealing with a lot of stress and a lot of depression, and I was gaining weight, and I didn't like that either. You know, my suits weren't fitting me, and I took the doctor's recommendation, which was, you know, hey, let's do the surgery. And doc, you explained to me really well what the procedure was, how it can change my life, and risks and the pros and cons and whatnot. And there was no other option. I was like, for me, it was either be miserable for the rest of my life, or get the surgery and see how it turns out. And sure enough, it turned out wonderfully. I'm back now at it. I am back in the gym, lifting way better than I was when I was in high school. It's just been a complete life-changing experience. Surgery was like 5 years ago, I think, 4 or 5 years ago. And ever since, I've just been living life back to where I was before, you know? So yeah, Doc, it's been a pleasure, and I'm so happy I get the chance to explain and tell people about my story, you know?
No, thank you, Zach. It was an honor to take care of you.
Yeah, thank you.
So Zach, before surgery, what was your activity like? And then after the surgery, what was your activity like? And how long was it till you got to that point?
Sure. Before the surgery, I was dealing with a lot of pain down my leg, the sciatic nerve, and I wasn't able to do hardly anything. I literally was, I remember being in court and having to put a lot more weight on my left side, because if I put any pressure on my right side, on my leg, and stand on it too long, it was a lot of pain going down my right leg. And then after surgery, again, a complete different ball game. I'd say it took a couple weeks to just make sure that everything settled in right. I'd say after surgery was, again, I was back in the gym not too long afterwards. I mean, I was coming to PT, had a wonderful experience here with the staff here. They were, showing me the things I could do, the things I should avoid doing for the time being. And I remember eventually at some point that they were just like, it looked like I never even had the injury, right? They were just like, you're back at it. And if you want, speak to the doc. I talked to Doc Chappuis. He's like, you're cleared to go. If you want to go back to the gym, see how it works, go for it. It took a couple weeks, right? But again, it was well worth it. And I remember it happened in the summer, 2018 or 2019. And by the fall, I was back at doing normal things again and actually having my life back, actually having a little bit of normalcy back, you know what I mean? And clear of mind, free of that pain. That's night and day, so. My scar was about 2 inches long. It sits right below the belly button. After a couple months after following the surgery, when the swelling and inflammation went down and I was able to get back in the gym, it's literally hardly ever noticeable. And I think now, because things are fitting me better, my clothes are fitting me better, my stomach is flattened a little bit better, it's one of those things that I don't even notice. And if people do notice, that I tell them what happened, and I say it with pride, because I'm a lot better now than I was before. I mean, there's nothing more I can say. I mean, I know you handle these surgeries quite often. I just don't know if you are aware of like the gravity of like how people are changing afterwards, right? And I know you're a busy man. It's one of those things. It's like you put your hands on somebody, you make them better. You know what I mean? You got the Midas touch. It brings so much more life to these people. For me, I felt like I was just like life was over. I mean, you know what I mean? Like I felt like I'm never gonna be back to where I was. You came in there and you were confident. You're like, let's get this done. We can handle it. We've done it before. You were excited to help me out and do it. I felt comfortable. You know what I mean?
Nice.
And I know, you have these opportunities to do that, but the profound change that you can cause in someone's life, it's like, you have no idea. And I thank every moment that I had the opportunity to come in your office and have that consult with you and actually get this done.
Well, Zach, thanks. It was an honor to take care of you, and appreciate you choosing us.
Yeah, awesome.